I'm Missoula Mayor John Ingen, and it is Tuesday, the 28th of April, a beautiful Missoula day. And with me this afternoon is Missoula County Commissioner Josh Slotnick. We wanted to take a little time today, just the two of us, to talk to you a little bit about new information that was a function of last week's order from Governor Steve Bullock and our local health officer, Ellen Leahy. We sense that there's a little confusion and some questions out in the community, so we're going to try to do our best to clarify a little bit today. And Commissioner, would you mind starting with schools?
Certainly. So the governor did say that schools could open, and to clarify that, what he said was that local school districts would make that decision. So the biggest district in the county is MCPS, and they're actually going to be meeting tonight at 6 o'clock to begin deliberating on this issue. And if you would like to have your wishes heard, you can reach out to MCPS on their website and let them know what you think. They will be deliberating tonight at 6 o'clock. If you live in a different district, you can reach out to your district via their website and let them know what you think as well, as these deliberations are ongoing and decisions should be soon.
Thank you, Josh. And we've been talking about this pretty relentlessly in our leadership meetings most days of the week in consultation with Rob Watson, who is the superintendent of Missoula County Public Schools. Rob, I believe, will recommend that schools remain closed for the duration of this school year. And that's certainly advocacy and consensus among community leaders. We think it's too soon to open. We think the complications associated with that are too difficult to overcome. And we don't want to put people at risk. So if you want to weigh in, you have that chance tonight. We have certainly done so on your behalf. So there's a question about how come I can go to a store, but I cannot get my hair cut? And the challenge here is that how to maintain social distancing in the really intimate setting of a salon. And our health officer, Ellen Leahy, in consultation with her board and other community leaders, as well as experts in the field, as well as folks who are actually in the business of owning and operating salons, have told her they don't know how to do this safely. That is not a universally held opinion, but what we know is that today it's a real challenge to maintain that safety. I know that Ellen continues to work with staff and with practitioners to try to figure out a way, if there is a safe way for those businesses to reopen. We recognize that it's a challenge and a problem, and I know that no one's taking it lightly, but they're certainly working on it. Other stores are going to be required to maintain social distance, and the guidance that the health department is providing is allowing all of those stores that weren't open before as non-essential businesses to reopen under particular guidelines to maintain safety.
Thanks. So one of the questions out there, given that we're not supposed to be gathering in groups larger than 25, is what's going to happen with farmers market? And I can say that both the mayor and I are committed to figuring out a way that we could do something that meets the goals of farmers market, but it's not going to look like farmers market traditionally looks like. Efforts are ongoing to kind of crack this nut. How do we get food grown by our local farmers into the hands of our brothers and sisters here in Missoula who want it, and do this in a safe way? Regular farmers market's not going to happen, but we're trying to figure out what can happen.
Well, and folks really miss that event, right? But the real meat of the farmers market, as it were, is making sure that those local producers have a market and an audience and an ability to make a living. So the commissioner and I are committed to working with the health department to see what we can come up with. It won't be fast, but we hope that we can get there, and we know that folks in the health department are absolutely sympathetic to the cause and would like to help us figure out a way to do this safely. So we're wondering why some businesses are still restricted. As you know, Ellen Leahy had directed that all retail businesses selling goods may reopen or stay open on May 1st, Friday. All of them, though, must develop plans for social distancing. So we needed a little room to breathe, and for those businesses to retool in order to accommodate that. Those retail businesses that have been closed were allowed to reopen yesterday with curbside service and delivery, and they can open the doors to customers, again, based on those important social distancing and safety guidelines on Friday.
Great. So another thing people have asked is who gets to decide these things? And what the governor made clear was that our local health officer is the ultimate decision maker in these terms of what remains closed, what stays, what gets to be opened up. One of the things our health officer has highly recommended, and all of us should follow this, is if you're out in public, wear a face covering. The face covering is super important. It's a civic act. This isn't protecting you so much as protecting others from you. As we know now that a very large percentage of people who have COVID-19 could be asymptomatic. We often don't know. Do something for the people you're around, and if you're out in public, wear a face covering, and you can get creative and fun with it.
Thank you, Josh. So I am not an epidemiologist, nor have I ever played one on TV, but I can tell you that what I know, what the experts say relentlessly, is that social distancing, face masks, other things that keep us unfortunately, but necessarily isolated or out of touch and unable to infect someone else is hugely important. There is a critical need for more testing, and at Missoula County, we have additional testing at our fairgrounds facility. The Centers for Disease Control just opened up a new set of symptoms that they suggest should be triggers for testing. So if you call 258-INFO, you can talk to a public health nurse, most likely an infectious disease nurse, go through a simple screening, and if you have any of those symptoms, you can get to a test in your car, quick, painless, and we can know more about the transmittal of the disease, how many cases are here, and certainly for your own benefit, knowing whether you do or don't have it, and you can make appropriate decisions based on that. That's 258-INFO, and it's pretty easy to get that done.
There you go. Well, thanks a lot.
Well, thank you. As the mantra we keep repeating on our leadership calls is that we don't want to do this again. So we're rolling slowly, we're rolling cautiously, and I think we would all rather be criticized for being too cautious than not. And frankly, only time will tell, but we're doing our best here. We have had really a really good experience, all things considered, with regard to transmission and caseload here in Missoula, and we want to keep it that way.
Yeah, we're doing really well in flattening the curve, which means what we've been doing has been working. So for the most part, we'll keep doing it. Thank you.
Thank you, Josh. Good to see you. Take the rest of the day off, will you?
Thanks, sir.